Welcome back to the Nutrimedical Report, and we welcome your questions on wellness issues this hour. We're going to go through some more protocols and some more advanced nutraceuticals. There are a number that are in production now, but the main thing is major improvements in a lot of our protocols and ways of validating it. And I'll be including the kinds of tests that your doctors should be doing, including especially if you are wise, you'll select a functional medicine doc, and I can help you with that. You can go through something like AMericanACAM.org, ACAM.org for the American College for Advancement in Medicine. They're the largest of the academies. They often have collaborative meetings with the American Academy of Environmental Medicine. If you don't see one of these certified doctors that's certified in functional medicine, and there's several other academies, you're kind of wasting your time because you're going to see a toxic doc. They're going to put you on drugs that, number one, are blacklisted. If you just get a PDR and read the black box warning for many of these drugs, they're dangerous, and they shouldn't be given to many of the conditions in which you're even having. This is basic medicine. Don't give beta blockers to someone with asthma. Don't give beta blockers to diabetics. Don't give calcium channel blocker to someone who has already dementia because you're going to cause their brain shrinkage and more problems. Don't give CoQ10 to people in heart failure. Don't give certain antibiotics to children because they're going to increase the risk of autism. This is published literature, so we need to start selecting for the right kind of doctors, and I think with time, we need to be much more responsible. Doctors, and to a great extent, don't want to know this if they're conventionally trained, and the doctors that do want to learn something, I never get resistance if they're willing to call me. If their patients will say, my doctor will call you about this or that issue, and they call, I always train them. It's very, very simple. Never get resistance. Always helpful. Always thankful that I've empowered them with new technology. A lot of it nutraceuticals, discontinuing certain drugs, starting lifestyle and other changes, and it really makes a difference. Now let's start off with multiple sclerosis. This is another protocol. Had a really, I have all kinds of amazing requests, and I got to thank all the people out there that make these requests, not only here but around the world. We have requests from Norway, Japan, South Africa, South America, Chile, Argentina, Canada, New Zealand, Perth, Australia, everywhere in the world. And we try to put together protocols, and in a sense we have satellite stations. We have people in Scotland that buy nutraceuticals and they distribute to their friends and neighbors. We have wellness clinics in Shanghai, China. We have wellness clinic in Singapore. Really is quite amazing how they'll follow our nutraceutical protocols, and we have the most advanced nutraceuticals, always working on advancing our protocols and ways of investigating to prove it too. Not just saying, well, this is what you take. This is not just vitamin therapy. This is lifestyle, diet, nutritional functional medicine, biochemistry, detoxification. Now, multiple sclerosis, and this is interesting, the story, if you look back at MS, there's a direct link to called certain areas where there's a northern European area where the person before their puberty has less vitamin D exposure in the northern latitudes. So vitamin Ds are often low in people that develop multiple sclerosis. Number two, there's a link to spirochetes, especially there's 34 different strains of spirochetes, including the different major classes of Lyme disease, babesiosis, and ehrlichiosis, which are all spirochetes. And here in North America, they're carried by the primary vector, the white-footed mouse, and they can vector through insects, such as ticks, etc., biting insects. First thing we do with MS is we try to turn off the T lymphocyte activation, and we use a myelin basic protein capsule called sphingolin. And sphingolin, S-P-H-I-N-G-O-L-I-N, 2 capsules 3 times a day. We then try to turn off the allergic reaction and the cytokine level in the tissues, and that's Allergon, 1 to 2 capsules 3 times a day. We bring that special enzyme in from Europe. It's unique. Allerblock, the most powerful antihistamine blocker, because allergic reactions, including food allergy, if you have a food allergy to any food and you have MS, you're going to have a major flare-up. You go from walking to being a walker or a wheelchair. So Allerblock, 1 capsule 3 times a day. Very common to see things like milk allergy, lactose intolerance, gluten reaction, especially to wheat. Any kind of food allergies, and you can measure IgG and IgE levels in the blood. Labs such as Great Plains Laboratory is one of the best for measuring IgE and IgG, and they'll tell you exactly what foods to avoid. It's better than even an elimination rotation diet. And we'll be getting Dr. William Shaw back in the program to talk about that and other things like toxic heavy metal challenges, etc. Organic acids, genetic imbalances, all kinds of gene SNPs. It's pretty neat. Next, we want to remyelinate the nerve fiber tracts. You only need 3 or 4 layers of the wrapping around the nerves, which is called myelin. that wrapping basically makes the wires work again. The average nerve beforehand usually has 20, but if you only get 3 or 4, you can get reestablishment of normal nerve conduction. So we want to use NutriFos, 2 soft gels twice a day, and Neurogen, DHA, 2 soft gels twice a day. Omega Supreme krill, the phospholipids in the krill oil are phenomenal for remyelinating the damaged oligodendrocytes, the myelin sheath on the motor fibers and the sensory fibers, the vibrational fibers that pick up proprioception position sense. So people with MS often can't feel the floor in terms of position, so they can fall over easily. They don't have, they can end up with dysmyelination of their motor tracts, so they can get weakness, and they lose the myelinated sensory nerve tracts to the A delta. So very important to remyelinate those fiber tracts. We got to stop the free radicals. There's high level of free radicals in their brain. So cell detox glutathione 1 to 2 capsules 3 times a day, and Nutritrala 1 tablet 3 times a day minimum, up to 2, and Regenerax 1 capsule twice a day. These are gene switches. They'll switch the genes on to help turn on the protective enzymes in the microglia, which is the immune cells in the brain. MS patients respond very nicely to increasing the levels of norepinephrine and dopamine, and we use that with Narival, which is acetyltyrosine, which will increase norepinephrine and dopamine, and BH4 biopter in a capsule twice a day. We also find that we can, with methylation pathway support, using the Samethyl, which is coming back at a back order, which is the Samethyl crystals in nitrogen sachets, lemon flavored. You can put it in the buccal side of your mouth, or you can put it in juice and drink it right away, because it's very powerful and it loses activity quickly. So that's why we don't mix it with things. We actually open the sachet and put it in your mouth, under your tongue, and it goes poof right directly to your brain and your peripheral areas. BioLVR, activated B6, very important B vitamins, especially B6, B12 and folic acid. These are also very important with myelination. For them, it requires methylation, so the methylation pathway support is very important. CoQ10 is very brain protective, and CoQ10 ubiquinol. So we recommend CoQ10 ubiquinol 3 soft gels twice a day, minimum to 4 twice a day. We also recommend a drink in perhaps a juice or smoothie. Acetyl L-carnitine ALC-1000, half a teaspoon, and D-ribose, half a teaspoon in juice or smoothie 3 times a day to raise the levels of energy and levels of ATP and ADH. We recommend the avoidance of foods. You can do Great Plains laboratory testing. Avoid alcohol, genetically modified foods, sulfates, aspartame, Splenda, MSG, etc. Anything at all that you can't pronounce, don't eat it. I like recommending 1 or 2 meals a day substitute of Ageless Energize or Ageless Regular, Life Support, NutriComplete, Omega Cod Liver Liquid, and Nutridyne. And a great number of people with MS also have other organic problems with hypothyroidism, hypoadrenalism, because their body's under stress. So if you measure free T4 and free T3 and free reverse T3, you often find their core body temperature low. So they need mitothyroid 1 to 2 capsules in the morning, Nutridyne 10 drops minimum twice a day, and in the adrenal support gland as well, 1 capsule in the morning. They may require also DHEA 25 milligrams for female and 50 or 2 tablets for male, and pregnenolone 100 milligrams for either sex. We'll recommend increasing total body magnesium. If your magnesium potassium is even slightly off or drops due to diuretics or stress, you can have an MS attack. So magnesium glycinate malate, at least 4 to 6 capsules twice a day. Magnesium potassium citrate, which will increase potassium. That amounts 400 milligrams of potassium a day in that, because 99 milligrams per capsule. So that'll raise the total body magnesium and potassium levels. So that's the primary protocol for MS, and we can modify and add other things depending on other health problems that may be present. But you should see dramatic improvement in myelination, quiescence of the illness, stopping aggravating food allergy reactions, toxic chemicals like MSG or MSG-like compounds, because there's many things like hydrolyzed vegetable protein and so on that have MSG-like activity. Back in a moment, 800-259-5791 for your questions on health issues.
Up until now, we have been losing the war on multi-drug resistant superbugs that have emerged due to the overuse of traditional antibiotics.
Welcome back to the Nutrimedical Report, and your calls are welcome in any wellness issue. 800-259-5791. One of the calls we often get is of people with chronic fungal infections, chronic candida, chronic jock itch, chronic throat infections, chronic diabetic intertrigo, where they have rashes, where there's folds of skin, problems with chronic foot fungus. And the first thing we talk about is that the primary nidus, whether or not it's recurring vaginal yeast or rectal or oral, is it's in the GI tract. The first start is berberstatin. Berberstatin is a very amazing berberine product. It's the highest quality berberine. It will clear out the pathogenic yeast in the gut, but it also helps to stabilize the gut peptides, such as proterolin helps to raise metabolic rate and the conversion of T4 to T3 to reverse thyroid resistance syndrome, which used along with mitothyroid, nutriodine, and adrenal support. Next thing for jock itch is we recommend NutriDefense. This boosts your body's immune system. The NutriDefense has the most powerful NK natural killer cell stimulant present. Then we recommend Allison Med, not just Alamax, because you want to really clear it out. You can drop back to Alamax later. Allison Med, 2 capsules 3 times a day for at least a few weeks to a month, and then drop to 1 3 times a day. Drop back later if you need to a low dosage to Alamax, which is about 1/3 the dosage of the, or 1/4 the dosage of the Allison Med. Silver 100, 1 spray per 3 drops per 10 pounds body weight under the tongue. Rinse the mouth first thoroughly to make sure you clear any yeast in the mouth before you, because it can recolonize the lower throat and the GI tract. And take 3 times a day. Immunoglobulins, Immunomax, a teaspoon twice a day in a smoothie, or 3 capsules Nutrimune twice a day. And a living probiotic, the Roselle 6 strain, which is the most powerful, popular strain in the world, from Paris, the Pasteur Institute. We have an exclusive contract, 1 capsule twice a day. And then the most powerful probiotic in the world, the How Are You strain, which is the Living Probiotic Ultra. You need only 1 capsule every 2nd or 3rd day. You don't need it daily. Not unless you have something very serious like acute ulcerative or colitis or Crohn's disease or an acute bacterial enteritis that's very severe with bloody diarrhea. We recommend also that you apply to the skin, to any areas where you might have candida, Silver 100 and Alamax cream. Those are very good. The Alamax cream, I don't recommend it if you can, the nutriodine, because it stings a bit with the alcohol base in it, but the Alamax cream, the Silver 100 is the most important, and then the Alamax cream. Trying to clear the gut, I recommend, in the sense, a bit of a low carbohydrate, low glycemic index, fast, if you can call it, with glycemics, ageless smoothie. You can use the Ageless Energize if you're preferring weight loss. Omega cod liver liquid will help. And, of course, the smoothie twice a day for snacks and other things. Apply topically to the groin the Alamax cream 4 times a day, Silver 100 spray, and I recommend the Magna soap, which we now carry again. Magna soap is really good, and when you're showering, use the Magna Charge to the areas of the body, the rashes, whether it's on your groin or other areas. Magna Charge, very effective to the areas, so that'll help to clear it up. And to heal the areas, you can use Magna Smooth, which includes Arnica montana. Magna Smooth. So we have all those products now available. The next protocol I'd like to touch on is to deal with the issue of both the activated vitamins. Our vitamins, Vitamin Mineral Max and Minerals Plus, and of course the minerals present in our Ageless Energize, Life Support, and Glycemics, etc. They're all the tracks, amino acid chelates. All of our vitamins contain the activated final step of all the activated form of every vitamin present. No other company does this. And then when we're talking about heavy metals detox, the primary detox is Keeler Max, which is usually 2 to 4 capsules twice a day. Ultra Liquid Zeolite, which is the only non-acid wash zeolite. It's best priced, by the way, compared to any other zeolite out there, and it's a better product. 13 drops in filtered water 3 times a day. And we recommend to mobilize the toxic heavy metals and chemicals, Proline Infrared Sauna, Lumen Photon over the target organs, which is a NICO setting, and Soma Pulse, which is very good pulse magnetic field over the area. You're detoxing your brain, put it bitemporal over the kidneys, over the heart, liver. Heart, especially if you're going to deal with things like heart failure, hypertension, because heavy metals and free iron are a very important part of the reason why CoQ10 has been interfered with, and bisphenol A, as well as endocrine disruptors, disrupt CoQ10 metabolism. We have a lot of people requesting things like, how do I get more energy? Well, Start off with Neurival, which is acetyltyrosine. Use Cognition Plus, which is going to be neuroprotective of the brain, a capsule morning and midday. Brain Power Vinpocetine, a capsule morning and midday. And brain protectant is CoQ10 Supreme Ubiquinol, the special ubiquinol form. You want 3 soft gels twice a day. ALC 1000, half a teaspoon, and D-ribose, half a teaspoon as a drink or smoothie or with juice. I often will recommend you mix that with a Calm Mind. It'll keep you calm as well as energized. And, of course, the smoothie, we talk about Ageless or Ageless Energized, Life Support, Glycemix, cod liver, Omega cod liver liquid, at least, I think for the whole blender, at least 30 mils for a big blender. Nutriodine, at least 1 full dropper. And you mix the smoothies up and keep it in your fridge, and you can drink it through the day as a couple snacks or, say, breakfast, lunch. If you're trying to improve cognitive function, Cognition Plus, a capsule twice a day. Brain Power, a capsule twice a day. Neurogen for myelination and Nutrifos. BH4 Biopterin, a capsule twice a day. And BioLVR, a capsule twice a day. For chronic anxiety, Calm Mind. Fantastic stuff. 1 to 2 scoops in filtered water. Minerals Plus, which contains the organic form of lithium orotate at the right concentration, not a toxic level, but the healthy level, because lithium is a healthy mineral. BH4 Biopterin, again, pops into the equation. And you may add also, for anxiety, methylation with Samethyl and BioLVR, which we also mentioned before. So that gives you some ideas on how to stop those. But the Calm Mind is fantastic, along with these other support nutraceuticals. When we look at protocols for cell phone protection and bitemporal, we had one lady who was actually complaining, and their symptoms were so pronounced on exposure she couldn't even bring the cell phone near her head. So the first thing is cell detox glutathione to reduce the peroxynitrate in the brain. Nutritrala, a tablet 3 times a day. And Regenerex, a capsule twice a day. Neurogen and Nutrifos, again, for remyelination and preparing the damaged blood-brain barrier and cell membranes. Omega Supreme Krill, 2 soft gels twice a day, and Omega cod liver liquid, 10 mils as a smoothie in the morning. Cognition Plus and Brain Power again, and CoQ10 Supreme Ubiquinol and ALC 1000 D-ribose as a drink for maintaining energy. And the main thing is get one of those air tubes if you're going to have a earphone, so there's no direct contact with the ear, bringing the electromagnetic pulse in. You can get these little pockets at less EMF, so your cell phone can be in your purse or pocket, but it picks up the radiation pointing out, not against your body. And never bring a cell phone near your head. Always talk on a speakerphone, and you can have one of these little pockets that basically you can keep the radiation away from your body. So it's pointing away from you when it's connecting to the cell tower. Very important. For cataract recovery, we recommend, of course, the CanC eye drops, Vision Max, Nutritrala, Neurogen, which we talked about before for eye recovery, and Lumen Photon Therapy setting 7 and setting 3 for healing and NICO, and mild hyperbaric oxygen Summit to C. You may add supplemental oxygen too at 1.3 atmospheres with an oxygen concentrator like an even flow. If you have questions, give me a shout. Right back with more protocols for you. Welcome back, and your questions are welcome at 800-259-5791. We had a recent request, and these are actually recurring kind of problems of spinal stenosis. And when people get a diagnosis of spinal stenosis, they're often told that they've had this or that study. The most accurate way anatomically of identifying it is a CT myelogram or a radiomagnetic contrast technetium-99 scanned MRI scan. But even then, if you have anatomic encroachment, it doesn't mean you have spinal stenosis. The ultimate is that you can actually draw cerebral spinal fluid, and you'll see elevated tumor necrosis factor alpha in the fluid directly at the dural nerve sleeves of the nerves involved. So you have to reduce the cytokines. Some people are getting transforaminal steroid injections. They'll help temporarily, or a transforaminal nerve block. The real issue is spinal stenosis is an inflammatory reaction where there's inflammatory cytokines happening, and there may not actually be full anatomic encroachment or compression of the nerves or the dural nerve sleeve, but there's inflammation there. So what you want to do is restore the normal connective tissues, reduce the swelling, which we can do with tendon mender. It makes the tenocytes lay down and relax and become less swollen. We can use joint performance that's going to remyelinate So we recover the cartilaginous things of the apophyseal joints, which if they hypertrophy tend to encroach on the neural foramen and the canal, so the triangular space collapses. We can use leptin metabolic, which helps to stop the cytokines that are often elevated in Syndrome X, because 75 to 80% of the population by age 50 have elevated blood insulin resistance. And when you use leptin metabolic, it's going to lower that level of leptin and insulin resistance, and it's going to reduce the cytokine levels, the inflammatory molecules in the joint space. So that helps a lot. We can repair the collagen of the fibrillated front of the disc, the apophyseal joints, little joints on either side, the ligamentum flavum, and the other structures that are myelinated, they have actual nerve fibers. They're innervated, so they actually cause pain. There's only 4 structures: the dural nerve sleeve, the ligamentum flavum, the yellow ligament in front of the spinal cord, the back of the disc called the posterior annulus, and the apophyseal joints, little joints. Everything else is anesthetic. So when you use Collagen Max, then we recommend Mountain Red Velvet, at least one of the 3 capsules. You want to punch or open it up and hold it under your tongue before swallowing for about 10 minutes. Inflamex. This is very good for stopping interfascial adhesions. A lot of people get told they have spinal stenosis, and they actually have multiple soft tissue compressions of the nerves. But firstly, starting off with the A delta and C fibers that can cause pain, and maybe eventually some compression of the big myelinated nerve fibers. Sometimes an EMG nerve conduction study done by a neurologist will pick up EMG NCV dropout, but those tests are only about 42% sensitive. The Axon 2 scan, which if you contact me, I'll send you over to Dr. Jim Hedgecock's facility in Huntington Beach, California. They've trained docs across the country and outside the country on quantitative sensory nerve testing to identify the nerve tract level, spinal nerve root, peripheral nerve, exactly where the pain generator is, and it can identify the E delta and C fibers of the specific dermatome or nerve. That helps a lot diagnosing the problem. It'll tell you where there's a joint subluxation that can require osteopathic or chiropractic, areas where interfascial nerves are being trapped because of scarring, or interfascial adhesions, or we call thoracic outlet, or repetitive motion injury, where the nerves are trapped with scar tissue and swelling. We use, of course, all kinds of other nutraceuticals to try to help heal. We use, of course, Nutrifos, Neurogen, Omega Supreme, and Cell Detox Glutathione, Nutritrel and Regenerex, and topically Magna Charge after shower or bath, Magna Smooth with massage, and Magna Soap, which has a magnesium as well for pain and inflammation. So I recommend magnesium soap. The best anti-inflammatory, of course, is topically to use curcumin, which is a very, very powerful anti-inflammatory, especially because it's liposomal. So spinal stenosis responds to lumen photon, setting number 7. Usually recommend a few hours a day, and then start off very slowly, 5 minutes of the NICO setting. Vibrational exercise with the vibrational platform, very powerful, 35 to 50 hertz. Somal pulse will reduce pain, usually from a 7 or 8 down to a 2 or 3 within 20 to 30 minutes. And mild hyperbaric oxygen also helps 1 to 2 hours per day, dramatically reducing. You can do DXR 9000 lumbar traction with an osteopath or a chiropractor or MD, physiatrist. I recommend sometimes if you have a nerve fiber tract that's been identified by your Axon 2 scan, you could do a transforaminal nerve block, which sometimes will block the inflammation at the dural nerve sleeve level, where the elevated levels of these inflammatory molecules like TNF-alpha are causing pain, stimulating the nerve fiber tracts in the nerve sleeve of the exiting nerve. That's one of the most common and simplest ways to correct it. And then, of course, the use of epidural anesthetics. You can't do too many shots, though, because more than 4 or 5 injections increases the risk of CSF leaking, especially in the lumbar spine, and increases problems with a slow leak that can cause problems with low pressure in the cerebrospinal fluid. So I tell people don't rush into those. Only about 25 to 30% of people are candidates for spinal pumps and stimulators, and they only last on average 2 years. And from what I found in insurance, it takes about 2 years to even go through the approval process with the stupid insurance. So people that were candidates, basically, often their condition deteriorates, so they're no longer really a good candidate after a couple of years of waiting from the insurance interference. So I worked with the Poudre Valley Pain Clinic, the main clinics in Denver, mapping pain out in the early 2000s, and we would send people for their fancy blocks, which did help tremendously. Also, prolotherapy sometimes can help if you get a nerve, if you know what nerve level you're dealing with. Prolotherapy can be helpful as well. But I like the devices, the Lumen Photon, Soma Pulse are fantastic. They're non-invasive and they don't put you in any danger whatsoever. So, how can I compare the two? I mean, it really is pretty amazing. We have a lot of people requesting information on prostate cancer. And the first thing to start off with is if you're trying to prevent prostate cancer, if you've had a diagnosis in the past but you're trying to fight it, Maligna Block, at least a capsule 4 times a day, and the ellagic acid. Ours is the Terminalia turbulea plant. The Terminalia turbulea has 300 times the amount of ellagic acid as regular pomegranate. Ellagic acid, a capsule 4 times a day. Maligna Rest, and this product is able to turn off the metabolism of cancer cells, the hexose monophosphate shunt, that's its primary source of energy. So it basically starves the cancer cell apart, at least a packet or in a smoothie or juice twice a day, or the tablet forms. And the Inflam X, and we recommend 3 to 5 capsules twice a day. It strips off the fibronectin capsule around tumors or secondaries, even if it's a blood cell-borne cancer. It'll help to strip off the capsule so your immune system can find and destroy it. Cell Defense, the most powerful anti-cancer nutraceutical is curcumin, but we have the most powerful slow-release form called Cell Defense. Myco D2 has ergothioneine. It has vitamin D2. Very, very powerful anti-cancer effect. It's a whole range of different mushrooms that fight cancer. Our other form of name for the Myco D2 deals with malignancies, so it's very powerful for fighting malignancies. I've got to raise vitamin D levels. D levels, if they're high, your body's immune system surveillance and ability to kill cancer is much higher. So we recommend at least 3 soft gels, 5,000 units twice a day, or around 30,000. Carbo Block, you want to keep the sugar levels low. Sugar feeds cancer. It's like a bad teenager or preteen. And Carbo Block, 1 to 2 capsules before all meals and snacks. I recommend the Glycemics Ageless Life Support, and at least 1 day a week just go on a Glycemics fast. At least 2 or 3 days a month go on a water fast. Vegetarian diet with fish maybe once a week or twice a week. No other forms of meat, especially because of the biotoxins. Omega cod liver liquid, at least 10 mils in the morning. High dose Power C. And for every 3 Power C, we're talking about 6 to 9 capsules of Power C, at least 3 times a day. Full vitamin K2, 1 for every 3 Power C. And magnesium glycinate malate, because cancer is often a stealth pathogen associated. Silver 100, 1 spray per 3 drops per 10 pounds of body weight. Ellison Med, and a Nutriodine, 20 to 30 drops. Come back, and this kind of melds into the next syndrome that people often request, is a person with very bad reflex sympathetic dystrophy, chronic pain syndrome, and fibromyalgia. Fibromyalgia is very common. And RSD, they're kind of different stages in the whole process that can continue. This particular gentleman was involved with an accident. It was actually in Australia. Ended up amputating a part of one finger and a good part of the other. Developed a spreading fibromyalgia or RSD syndrome that spread from the hand all the way to most of the body. And this bizarre syndrome can happen. There's underlying problems. The first thing to do is locally apply curcumin cream to the topical area of the region infected. Magna Charge and Magna Smooth. It's important to get magnesium levels up. Magnesium glycinate malate, magnesium taurate, magnesium potassium citrate. Bio-LVR for methylation for chronic pain syndromes. Life support, and of course to heal the tissues, tendon mender, joint performance. Leptin metabolic, Inflamex, and Cell Defense for stopping inflammation. Mountain Red Velvet for healing the tissues, and Collagen Max. And the most important things are the technologies. Lumen Photon, setting 7 for pain, and Nico for healing. Massage with the Magna Smooth, which includes arnica. Magna Charge at the end of the sessions, at least 2 to 4 times a week. And then vibrational exercise, able to turn off the reflex sympathetic dystrophy where there's abnormal nervous traffic occurring. I strongly recommend that those persons also detoxify, because a lot of time when someone gets an RSD, they have toxic heavy metals and toxic chemicals, so we need to address that as well. But that protocol is very helpful for turning off the inflammation in the body. The combination, it works really well. One of the other things that's very common is people have issues such as difficulty with emotional problems, with depression, and other issues. We talk about that with Calm Mind, BH4 biopterin, methylation pathway support with BioLVR and Samethyl. And we had also an unusual request, we call SRA, ritual abuse and child abuse as a trauma. Again, you have to deal with the physical, the emotional, and spiritual issues. BH4 biopterin for depression, cognition plus, and brain power. Neurogen and Minerals Plus for brain support. Omega Supreme Krill and Calm Mind, as well as the Smoothies of Ageless Life Support. On the spiritual side, I recommend small group interventional prayer sessions, eye movement desensitization therapy, which helps to block the autonomic nervous system, by Christian psychologists, because they're usually administered by a PhD Christian psychologist. You can get others, but it's best to have a Christian involved, because it can be autonomic triggers for dissociative identity disorder or multiple personalities. So that needs to be dealt with. They often shatter their personality when they go through these SRA sessions of ritual abuse. And then, of course, laying on of hands by those that are proven Christian healers that have dealt with in the past DID or dissociative identity disorder and MPD. You need to get someone who's properly trained and certified and knows how to do it in a godly way, so they don't end up causing more troubles. It's a complex process, not a simple answer. It has to be dealt with on a spiritual, detoxification, and physical level as well. We have sometimes a request. This one was from a couple all the way over in Europe, and they want to know what's the basic program to just start with detox. And we give them a very, what we call stripped down core. I recommend to start off with the smoothies of Glycemic, Ageless, Energized, Life Support, NutriComplete, Omega Cod Liver Liquid, and Nutridyne, to detox their bodies, Xenoestrogen Detox, NutriDefense, Keeler Max, and the Ultra Zeolite. And then for spiritual growth, they want to know how to get centered and increase detoxify their pineal gland, etc. And I recommend Indiamese, which helps to activate their intracellular mineral levels and activate the upper centers of the brain, the pineal gland, etc. BH4 biopterin, Minerals Plus, Vitamineral Max, Calm Mind, and of course, you can also use Samethyl for the methylation pathway support. And we recommend, of course, the DHA, which is algae-based. For Bible growth, I recommend spiritual growth. I recommend Bible study, especially Proverbs and Psalms daily, meditation on how Yeshua would deal with specific life conflicts and relationships. Probably fasting at least one day a week with either their glycemic smoothies, and at least 2 days a week where you do just a water fast only, two days a month at least. Talk about just opening yourself up to making God's decisions in your life rather than trying to second guess God. And then small home church, I think, is very important, which is why we're trying to start a small home church here in Vista, California. I was involved with home churches at the New Life Church in Colorado Springs, and I think it's essential that you have a home church. And we have Pastor Dave Lee, who happens to be my next door neighbor. It's fantastic that he is right next door here. So we have a room for a fairly good-sized small church, basically home study church. So if you're interested, we're going to be having Dave on probably at least once a month, and we'll talk about this. And if you're interested, we'll have a small fellowship here locally here in Vista, California. So that's kind of pretty exciting, isn't it? We have a request for how to treat gallstones. Gallstones dissolve if you expose them to magnesium potassium citrate. Same with kidney stones, and they'll prevent formation of them. When you use BioLVR, it helps us stop uric acid stones from forming. And if you get methylation support, so Samethyl and BioLVR, those help to stop formation of uric acid stones. Stop inflammation in the gallbladder, which can form stones. Cell defense. Phospholipids are very important to prevent stone formation. Nutrifos and Neurogen, and Omega Cod Liver Liquid, and Omega Supreme, because the right phospholipids will prevent the inflammation in the gallbladder that cause stone formation. Recommend also, believe it or not, lumen photon therapy. Lumen is very good for mobilizing the sludge in the gallbladder on NICO settings, and on setting number 4 as well as NICO, to mobilize the sludge in the gallbladder. And we've even had reports of people passing gallstones as soon as they start using it, or small sludge before it turns into full stones, which is really nice to not have to have a gallbladder attack. That's a very nasty thing to happen. We had a situation where we had an elderly person where they had requests for, they had pretty serious infections, and a relative they wanted to have hospitalized again with fluid in the lungs, inflamed airways, possible infection, calcified heart valve. Looking at the history, it's very probable the person has some degree of congestive heart failure, probably a secondary touch of pneumonia. So I recommend NUTRIMEDS, Silver 100, for heart support, CoQ10 Supreme Ubiquinol, 3 soft gels twice a day, magnesium glycinate, malate, and vein away, which helps to prevent proteinuria from the kidneys and help to improve the diuresis of fluids off the lungs. So vein away, at least 2 capsules twice a day. And this is a kind of a starter protocol, and we get more advanced, but it'll knock out the infection with the NUTRIMEDS Silver. It'll support the heart to pump better with the CoQ10 Supreme Ubiquinol, which is the most absorbed form. And then the magnesium glycinate, because all chronic illness is related to magnesium deficiency. And the vein away will support kidney function and diuresis of the fluids off the lungs, etc. So that's a good starter protocol for that particular individual. So that's a good program. We also have recently, we do QRMA reports, and I get some, pretty complex reports from people, and when we go through it, we actually go head to toe on every single aspect, and I usually will talk to them, have them send me their history. A QRMA is a remarkable way of assessing your health. The QRMA test, you would use the same machine. I recommend that people can even do the test daily, but send me a report once a month, once you're started on your protocol. We'll modify the protocol, see how you're improving. If you want to do functional medicine testing, I can recommend a test. They'll send the test kit directly to you. You can do blood, urine, stool, and every kind of culture, genetic tests, organic acids, and we can find out what's really going on, the underlying problem of your wellness issue. If you need to link up with a functional medicine doctor to try to complete the circle, I can help you with that as well. So that makes a big difference. Coming up in hour number 3, we're going to have John Moore on, and we're going to touch on a couple of issues. The scandal of the global warming data, it will be coming up, and of course we've now got proof that the United Nations and NOAA fiddled the data in the National Weather Service. We also have the illegals hopping the death trains to the USA, and they haven't fixed this problem. Obama's favorability has dropped below that of Bush and Carter, which is absolutely amazing. Evidence that Hillary Clinton has a bad heart. I've heard also she may also have Parkinson's disease. She's not really in physical health to proceed as a candidate for anything. And we have some amazing news coming up what's going on in Iraq, Ukraine. The Russians are now posting tanks on the border. Ukraine, the situation there is dire. The situation in Iraq, basically John Kerry's going to the area. We're going to talk about all this news and much more, what's on the inside reports from John's contacts inside the government. When we come back, and also Prepper School. And coming up this week, we have Keith Davies, who works with Walid Shubat. We're talking about the real issues of what's going on with Islam in the Middle East and the persecution and murder of Christians, and much more special coming up on Wednesday. And of course, major updates from